Well, first of all, there are other things they need to be doing before that. So I'll talk you through that first. First thing is that baby's going to be able to push their head off the bed, and that starts somewhere between 2-3 months. Then they start rolling somewhere between 3-4 to 5 months, and that's rolling from front to back initially. After that, they'll be able to sit upright, initially with some help, and then later on without help. So by 6 months, most babies are able to sit upright, hold their heads well, and actually be ready for feeds. The next stage is moving from that sitting position to a standing position. Before they get there, they usually will crawl or bottom shuffle. So not all babies crawl, by the way. Once they're able to mobilize, they can then stand upright. Again, initially with help. That'll either be your help or it could be the furniture. So they pull themselves to stand. And that'll happen somewhere between 9 months and 12 months. Now, depending on how active they are, they may actually start walking at 12 months, but there's a fairly broad time frame for establishing walking. And some babies will start 12 months, and others may actually not really be walking till they're about 18 months. That's fairly normal. And for boys, it can sometimes be slower than girls, and that's okay as well. In terms of speaking, they start to babble before they're 12 months of age. So by 9 months of age, they're already babbling. By 12 months, they might have 1 or 2 words which they think make sense. So mama and dada with the right purpose. And typically by 24 months of age, they've got quite a few words and phrases, and they begin to communicate much more eloquently with their family. And don't forget, once they become very mobile, you need to really baby-proof your environment and keep safety at the top of your mind. So sockets, corners of tables, anything that comes across to you as being a risk needs to be managed.